Now, we are pleased to have representatives of two National Forum members who will fill us in on new developments in their organizations. First will be Giuliana Crawford, Senior Vice President of the American Heart Association. Giuliana also serves on the National Forum Board of Directors. She will be followed by Andrea Sharkey, Project Manager at the New York City Department of Health and Mental Hygiene, who manages the National Sodium and Sugar Reduction Initiative. Giuliana?
All right, I'm really excited to be here and talk to you just briefly about the American Heart Association's commitment and goals in our high blood pressure work. We're really focused on 4 areas to address high blood pressure control across the country. The first being to continue our partnership with the American Medical Association that we all know as Target BP. We are working in about 1,000 clinics across the country to improve the high blood pressure diagnosis and control in clinical settings from a quality improvement perspective. Secondly, we're supporting access to expansion of blood pressure monitoring services across the country through public policy efforts and efforts with private payers. We've had a lot of great wins in this area in the past year or so with reimbursement codes out there for providers' time to be using self-measured blood pressure readings in their patients' treatment plans. And we really want to expand awareness of these efforts and expand utilization of these efforts in the clinical setting. Thirdly, we're really focused on supporting our communities through our work with federally qualified health centers. Again, this is really taking what we've learned through Target BP and healthcare organizations across the country and adapting it in models that really work well for federally qualified health centers, while also addressing social determinants of health that patients in these centers are facing, like food insecurity. And then our last strategy is really around working with community-based organizations, such as faith-based organizations or in workplaces, where these types of settings can also support self-management skills like self-monitoring of blood pressure and connecting members of the community to care in their community. I also wanted to share a really exciting announcement that was made in December. The Department of Health and Human Services, and specifically the Office of Minority Health and HRSA, did award the American Heart Association a cooperative agreement to work in 350 health centers across the country to really bring these strategies to life. The goals of this initiative that we're calling the National Hypertension Control Initiative is to first and foremost establish a nationwide approach to addressing hypertension and other outcomes as a result of COVID-19, specifically for populations most at risk. So racial and ethnic minorities, American Indians, Alaska Natives, and other vulnerable populations in rural communities. Of course, we want to improve health outcomes, specifically blood pressure control. There's a big part of this effort will be focused on increasing the use and advancing the use of self-measured blood pressure technology in health centers and throughout the communities for patients, increasing awareness and utilization of health programs and community services that can support patients, and increasing patient and provider education and training. The initiative is for 3 years, and beyond the cooperative agreement awarded to the Heart Association to do this work, there is an additional $60 million coming from HRSA to support these health centers in terms of efforts like stipends to do the work, purchasing of blood pressure monitoring equipment for their offices and for their community as well. And then finally, there's 4 major strategies involved in this effort, and you heard a little bit about that. The first being patient and public education. And in this first year of the initiative, we're focused on launching a national public service awareness campaign that will really continue to elevate awareness and education of high blood pressure, and specifically the practice of self-measured blood pressure and how that can play a role in your treatment plan. We'll be working in across communities and events that can target and reach high-risk groups, and we'll be engaging communities specifically around messaging regarding those risks, and then how communities can really support those self-monitoring techniques. With our healthcare organization and healthcare providers, of course, we'll be working in those 350 health centers to bring the evidence of target blood pressure to life, to transform practices and support healthcare providers in training and skill building. Community outreach and integration will be focused on our work with community partners to ensure we're reaching their patients, their people that they serve in the community with culturally and linguistically appropriate resources, and that we're bridging the community setting to the clinic, really creating those linkages where community members can see that the health center is there for them and they can transition in and out of those settings more seamlessly. And then finally, as with any effort like this, there is a robust project evaluation and management component. And so we will have a robust and rigorous evaluation plan that will help us determine what is working best in all of these areas, so we can not only improve blood pressure control in these 350 health centers, but then spread those lessons learned across the country, so we can really impact health centers all across the country and bring those lessons to life with other stakeholders we're working with, such as the American Medical Association. Thank you.
Hello, everybody. My name is Andrea Sharkey, and I'm a project manager with the New York City Department of Health and Mental Hygiene. Today, I'll be providing a brief update on the National Salt and Sugar Reduction Initiative, or the NSSRI. The NSSRI initially started as the National Salt Reduction Initiative, or the NSRI for short. At this point in time, we were focused only on sodium reduction. The initiative started in 2009 and was modeled off of an initiative from the United Kingdom. The New York City Health Department launched the initiative and convened a partnership of organizations from across the country. The partnership has grown to include over 100 organizations who have come together to make one joint ask of industry to create a healthier food supply. We're proud to have the National Forum as one of our members. The aim was to reduce sodium in packaged and restaurant foods as a way to reduce sodium intake and ultimately reduce the risk of heart disease and stroke. Working with industry, we collaboratively set sodium reduction targets for 62 packaged food and 25 restaurant food categories for 2014, 2012, and 2014. 28 companies ended up committing to reduce sodium as part of the NSRI. We analyzed changes in the food supply over time and observed that sodium density declined by 6.8% from 2009 to 2015. Since then, the FDA has released draft targets for sodium reduction in the food supply. With this interest from the federal government, we decided to shift our attention from sodium to sugar. The NSRI has since become the NSSRI. We announced that the initiative would be expanding to address added sugar in 2018 and release draft categories and targets. That kicked off a 2-year process to refine these categories and targets, which we did by soliciting feedback from industry. This past February, the NSSRI released voluntary sugar reduction targets. We released targets for 15 categories of foods and beverages, which account for about 60% of sugar in the diet. Categories include drinks, grain-based desserts and snack bars, refrigerated and frozen desserts, candies, cereals, condiments and toppings, and yogurt. We're asking companies to meet the targets by 2023 and 2026. For most categories, targets are set to be a 10% reduction by 2023 and a 20% reduction by 2026, except for sugary drinks, which we're asking for a 40% reduction. We'll assess progress against these targets over time. There is an opportunity for companies to publicly commit to meeting these targets. Companies can work toward meeting the 2023 and/or the 2026 targets in one or more category. A big part of this initiative is evaluation. The New York City Health Department will be leading efforts to monitor progress against the targets over time. We'll be tracking progress on the overall food supply and also at the category level. We're excited to share these targets publicly as guideposts to be used by the public health community, academics, and advocates, and to be used by industry, even if a public commitment is not possible. More information about the targets and our work on sugar reduction can be found on our website at www.nyc.gov/health/NSSRI. Thank you.